Welcome to the SIBO Doctor podcast with Dr. Nirala Jacobi, a US-trained naturopathic physician and medical director of the SIBO Doctor, an online education resource for practitioners. This podcast is intended for SIBO treating practitioners and aims to help educate how we may best serve our SIBO patients. Medical experts join us to discuss functional digestive disorders, clinical practice and research as it relates to SIBO and associated conditions. Head over to thesibodoctor.com where you can learn everything about SIBO from the basics to advanced treatments. You can also join in the conversation on the SIBO Doctor Practitioner Forum Facebook group. If you're a patient, please note this information is not intended to diagnose or treat medical conditions. Please ask your doctor before initiating any new treatments. We welcome you to head over to the SIBO Lifestyle Facebook group, where we post frequent tips and videos to help you on the road to gut health recovery. And now, over to Dr. Jacobi and the SIBO Doctor podcast.
Welcome, SIBO Doctor practitioners, to the very last episode of the SIBO Doctor podcast for 2019. In this podcast, I'm going to talk about the frequent questions I get from practitioners and patients about underlying causes and drivers of chronic, especially chronic SIBO. So we'll be getting to that. But before we get to the topic of our podcast, oh my God, it's been such a busy year here at the SIBO Doctor. And I just want to take a moment to acknowledge all the different things that we've done. So we've released a new course called the SIBO Success Plan. And that's really designed for anyone wanting more empowerment and information about SIBO and how to really improve and help themselves. So it's a great course that I created at the beginning of the year and closing out the 2019 year with the completion and launching of the SIBO Mastery Program, which is a 3-tiered kind of program that is for practitioners. And it was really a long time in the making because it covers a lot of different topics that we're going to talk about today in terms of the underlying drivers and causes of SIBO and how to really manage somebody that has multiple layers of different things going on. So really, really happy with how that program worked out. And you can find both of those courses on the SIBOdoctor.com. And the SIBO Mastery Program, once you've completed that as a practitioner, you can be listed in our database that's constantly being accessed by patients that are looking for practitioners worldwide who understand the complexity of SIBO and how to manage that. Plus, you get a little badge that says you're SIBO Doctor approved. So we're really looking forward to getting some feedback from practitioners. And as you know, my passion is educating both patients and practitioners about SIBO. And this year alone, I've written over 30 lessons, have been on 4 online summits, presented at 3 international conferences, and been on 10 guest podcasts, and not to mention having interviewed all of our wonderful SIBO experts and associated condition experts on our podcast here. Really, it's been a wonderful year for raising SIBO consciousness out there, because every day, I don't know about you practitioners listening to this, but many patients tell me that they do not have a practitioner where they are, and they may be in some far-flung corner of the world, but they really don't have anyone to work with. And that's been the intention behind not just this podcast, but creating the SIBO Doctor Education website that provides a lot of information and education for both practitioners and patients. And there are a lot of free resources there that'll also be, the link to all of that will be listed in the show notes of this podcast. This year, I just want to mention there have been some amazing speakers come on the podcast, and I'm so grateful that they have given their time so freely to help us understand some of the underlying drivers. And so I thought it's good to kind of remind us where we've been this year. So we started the year out in January with Dr. Kate Broderick, who spoke about hydrotherapy and the powerful way that water therapy can calm your nervous system, but also boost circulation and lymph flow. That's really important in SIBO, and help with immunity and your immune system. So listen to that if you want to learn how to do some water therapy on yourself. Then we moved to February. It was Dr. Sandeep Gupta, who's a well-known functional medical doctor here in Australia, and his specialty is mold and biotoxin illness from infections. But we talked about mold toxicity and all the ways that people exposed to water-damaged buildings can get sick. And SIBO is often a part of that for lots of reasons. So you can listen to that podcast if that's of interest to you. And Dr. Lisa Shaver, who is a dear colleague, practices in Portland, who talked to us about the importance of proper testing your patients before implementing a gluten-free diet and all the ways that gluten can contribute to ill health, even if you're not a celiac patient. And then a wonderful herbalist, naturopath from Australia talked to us about using herbs in different ways and how to combine them and how to address immune modulation. I really enjoyed that interview. And then the wonderful Dr. Alison Seebecker, who really needs no introduction other than she has dedicated her life to educate practitioners and patients about SIBO. So she talked to us about prokinetics and laxatives, and this was really an excellent overview and interview and lots of useful information there for both practitioners and patients. And I spoke with our wonderful nutritionist and naturopath here at the Biome Clinic about the vegetarian SIBO biphasic diet that we both co-authored and brought out. And we're very, very happy to get some positive feedback about the vegetarian SIBO biphasic diet and how to use it. So that's a free resource on the SIBOdoctor.com website. And we moved then to a couple of interviews about the nervous system and how injury to the nervous system and overstimulation of the nervous system can cause a lot of complications with SIBO and IBS. And we talked about stress and overwhelm and how to manage that with Dr. Nicolette Dellinger, who also put out an anxiety summit this year. So kudos to her. And the wonderful Sarita Ford, who is our counselor and hypnotherapist here at the Biome Clinic, talked to me about what patients experience when we recommend gut-centered hypnotherapy, which is a wonderful modality to help mitigate or at least ease some of the symptoms of SIBO, and just tremendous outcomes in research. Really amazing therapy. And Dr. Johan van der Bogarde, who's a gastroenterologist here on the Sunshine Coast in Australia, talked to us about the microbiome and different aspects of microbiome restoration, and also FMT, or fecal microbiota transplants, that he does in his practice. Fascinating interview, got a lot of great feedback on that one. And of course, the very well-known researcher and gastroenterologist, Dr. Mark Pimentel, talked to me about 2019 SIBO research and IBS research. Been waiting for that interview for a long time. So there's some great resources for you to review and add to your Christmas listening for, I'm just kidding, for the understanding of lots of different therapies are out there for SIBO. Last year, I created, just so that I could organize my own thinking around what the underlying causes are of SIBO. So I'll get into that next. And I did a Facebook Live on the SIBO Doctor Facebook group or Facebook page. So you can find that in the video section of the SIBO Doctor Facebook page, where I actually show you this chart that you can see the different, like 4 different sections of underlying causes of SIBO. So I want to talk about that first. And then I want to talk about other drivers, meaning other contributing factors to why patients aren't improving sometimes and why we're looking at chronic SIBO. But first, really, it's about 4 different categories of underlying causes. And also we have a free questionnaire that you can download from the SIBO Doctor that you can fill out and bring to your practitioner so that they can have some understanding of what might be going on for you. So let's start with the biggest category of underlying causes. So we're talking about a person has been diagnosed with SIBO. What has caused that SIBO? Because SIBO is not a normal occurrence. Something must have caused that to occur. And the biggest category of underlying causes is motility, of course. Something impaired the motility of the upper digestive tract so that the cleansing wave of the small intestine, also known as the migrating motor complex, has been disturbed and bacteria are allowed to grow in the small intestine. Now, that has a lot of subcategories. So the primary one that we think of when we think of SIBO, we think of somebody who had a case of food poisoning that was the typical either Campylobacter or E. coli or Salmonella. And that bacteria during the time of food poisoning secreted a toxin known as cytolethal distending toxin B. And so what happens is that toxin is so toxic, it causes a lot of this damage, but also it causes the body to secrete an antibody to it called anti-CDTB. And also the problem with this toxin is that when the body creates an antibody against it, it also sometimes accidentally makes an antibody against the migrating motor complex, as is typically the case with autoimmunity. It's sort of a case of mistaken identity. And what results from that is sort of an autoimmune attack on the migrating motor complex that continues even when the food poisoning episode has resolved. So now we're left with a damaged migrating motor complex that resulted from a food poisoning episode perhaps years ago. And now bacteria can just overgrow. So that is a very, very common cause of SIBO. And if you live in America and in, I think it's the UK and Switzerland, you can request, there's a lab. Well, the lab is in America, but you can have different distributors that will provide this test called the IBS Smart. And that checks for these antibodies. So if you are listening to this and you think back and you think, wow, I can't get on top of my SIBO, and yes, I've had a case of food poisoning, then this may be your cause. And testing for these antibodies might be really fruitful. So think about that. So that's the primary sort of motility issue with SIBO. But we also have other conditions that are in this category. For example, traumatic brain injury. So traumatic brain injury, we always think of somebody who plays football or somebody who was in a car accident or had something really traumatic happen to them. But it can also occur when you're a child and you fall off your bicycle, or you fall off a horse, or you fall on your coccyx and your brain is shaken. So this was actually a great interview that I did with Kayla Sandberg-Lewis, and you can find that in the SIBO Doctor podcast archives also. It's a good one because we don't often think about that as practitioners because it's very hard to test for. But you can, if you download the questionnaire, there are some questions that are specific to that in terms of loss of consciousness and things like that that you've had in your past. And there are some other really sort of deciding symptoms that can go along with that, poor memory, etc. So that's something that can also affect the small intestinal motility. And then hypothyroidism is also in that category of motility disorders, and chronic infections as well. So could be viral infections, could be chronic Lyme disease. It could be those kinds of really long-standing chronic reactivations or infections. And that is believed to cause damage to the vagus nerve. And the vagus nerve, of course, is the nerve that is also called the Great Wanderer, that wanders all throughout and innervates the digestive tract and other organs, and is really important in rest and digest. So when that gets damaged with chronic infections, we can also see motility issues. Diabetes can be a motility issue where unchecked blood sugar attaches itself to different structures, and nerves being one of them. So that can be a problem with, can cause a problem with motility as well. And then chronic stress. So we're talking constant overwhelm can definitely contribute, chronic motility issues. And then mold or toxic mold exposure that mold can release mycotoxins that cause problems or toxicity in the innervation of the small intestine, what's called the myenteric plexus. But it can also cause problems with the vagus nerve and also VIP, which is vasoactive intestinal polypeptide, that can also be reduced, and that can then cause slow motility. And also the dysautonomias that I've mentioned sort of throughout these podcasts. And those are more advanced conditions of dysregulation of your nervous system. And part of that is Ehlers-Danlos syndrome. postural orthostatic tachycardia syndrome. So when your heart rate goes up when you're standing and you're constantly dizzy and you have nausea, and it's a terrible condition. And of course, mast cell activation syndrome. They're all categorized as dysautonomias. They all impair motility. And then an autoimmune disease called scleroderma. So those are all in that category. The second category of underlying causes of SIBO is impaired digestion. So this could be a problem where, because of the stress that you've experienced for a long time, the signal to the body is chronic suppression of digestive juice output. This could be low stomach acid. This could be bile flow, very poor bile flow. It could be problems with your pancreas with digestive enzyme release. It could be brush border deficiencies where the SIBO has caused a lot of damage and your brush borders are missing, meaning the little on the microvilli of your small intestine, you actually have enzymes that are being released from these lining cells, and they help you digest. It's like the last part of digestion, and when that's damaged, that can also cause a problem. So impaired digestion is a category of underlying causes. Then we have impaired flow through the intestine, which means, all right, your motility is fine and your digestive juice may be fine, but you have something that doesn't allow the bacteria to leave from the upper gut. And that could be due to problems with previous surgery and adhesions and scar tissue. It's a really common scenario where we have scar tissue forming that attaches in the abdominal cavity to the small intestine, and it pulls it, and it causes a kink in the garden hose, and things can't move through very easily. So that could be because of abdominal surgeries like a C-section, having your gallbladder taken out, even something like having your appendix taken out. Anything that includes having an incision done in your abdomen can be cause for adhesion formation, but also endometriosis. Women that have endometriosis have very often a resulting SIBO because of that. And also ileocecal valve dysfunction. They're all categories of problems of flow through the intestines. And lastly, in this 4-sliced pie, we have medications. And so there are certain medications that slow digestion that allow bacteria to grow. And that can be opiates and narcotics, can be antispasmodics, it can be T4 only thyroid medication, can be proton pump inhibitors and tricyclic antidepressants. So think about your medications and maybe discuss that with your practitioner. Also, frequent antibiotic use. We think that causes a lot of more dysbiosis in the upper gut, but it can cause a lot of SIFO. And I certainly have my fair share of patients with long-term antibiotic use, either for chronic UTIs or urinary tract infections, or bronchitis when they were children, or Lyme disease in adulthood with long-term antibiotic use, and they have a really dysregulated microbiome and also in the upper gut. So it can cause a lot of problems. So those are the main underlying causes of SIBO. Then additionally, what we look at as practitioners, and I go really into all of this in the SIBO Mastery program, where I talk about advanced SIBO case management and how to really spot some of these underlying conditions and contributing factors that I call the bucket. So, and you've heard me mention this before, the bucket is really a lot of things that go into that bucket that might be contributing as to why you're not getting well. So let's say you have had SIBO, you treated it, you retested it to make sure it's gone, and lo and behold, it's gone, but you feel exactly the same. You really do have to start looking at other underlying factors. And so this is why I started to really look at things like mold illness and things like chronic infections that really help me and broaden my understanding of what can really drive these chronic conditions. But the bucket also includes things like environmental toxins. So if you have a pretty toxic environment, or inside of your system, you have a lot of toxins, either from exposure from your work or And that can be, it's not that hard to become toxic nowadays in this world. I mean, think about, for example, just the amount of exposure you have to plastics. Just as an example, if you drink coffee from a coffee shop in a to-go cup, that cup is plastic lined. So, it's not hard to get exposed to plastics. And I'm not saying plastic exposure causes SIBO. I'm saying put that in this bucket that we're slowly filling with underlying drivers. So environmental toxins that can include pesticides. I'm a big proponent of eating organic. So think about that. And anything that reduces your bucket can also help to improve overall health, not just SIBO. So then we also have detox impairments. So meaning that not only you might not be exposed to a lot of toxins, but you may have some impairment that doesn't allow you to really process and metabolize these toxins because of some genetic variants or because of nutritional deficiencies, because you've been on a diet for that long, a SIBO diet or whatever else diet, and you're kind of nutritionally depleted. That could happen. You can also have microbiome imbalances. That's very common when people have other issues that are not necessarily located only in the small intestine. They have other issues with their large intestine. You could have hormonal problems that are driving this with estrogen dominance or thyroid issues or adrenals. The adrenals are a big one. You could have too much oxidative stress and your mitochondria are really pooped out and you're not really producing a lot of energy. Mitochondria are your little cells, organelles in your cells that give you energy. So that could also be one of the underlying issues. You could have immunological issues and inflammation that's driving some of this. You could be in a state of complete overwhelm 24/7, which basically sends the message that you're in danger all the time. And so your body acts accordingly. And eventually there is a lot of fatigue and a lot of dysregulation in other systems. And as a result of that, you might have a real sleep deficit, which is, I think, pretty chronic in today's world. So that can also be, you could be having some issues with dehydration and poor acid-base balance, which causes your system to be way too acidic, and therefore you can't really detoxify well. You could have poor diet habits or you're just not exercising. All of these things are part of the environment that creates health or not health. And so when you have SIBO and you're not improving, sometimes it's not useful just to keep hammering away at the SIBO situation. Sometimes it's best to kind of take off the blinders and start looking at a much, much bigger circle of contributing factors that might be keeping you in a state of ill health. And I have seen many, many cases of SIBO be multi-layered. And I would go as far as saying that in most of my chronic SIBO cases, it's never just SIBO. That's the problem. There are many other drivers that contribute to why a person is not responding to treatment, may have relapses really soon. So that really is what led me to do all of this education and course creation, because I think a lot of practitioners need to fully understand, for example, how mold can affect your patient and why just getting rid of SIBO is not going to be the issue. The mold is the issue and the exposure to the toxic mold is the issue in that particular patient. Having too much stress and previous trauma can be the main issue for somebody. And I'm only talking about people that are not improving when their SIBO is cleared. So clearly SIBO was there, now it's no longer there, and their SIBO symptoms are still there. Sometimes it's easy. We can see a patient, the patient has SIBO, we treat it, symptoms are gone, happy days. Many times, and especially if the incredible growth rate of the Facebook support group, the SIBO lifestyle that we have, is any indication, there are thousands and thousands and thousands of people who understand the basic concepts of SIBO, may have had some treatment, but are just not improving. So that's really been sort of my mission in this whole past year and over the past really 10 years since I've taken up this specialty of SIBO and functional digestive disorders is to really tie all of these different layers together so that we have better treatment outcomes for our patients in general. I want to take this moment to just share my gratitude with my listeners. If you're a practitioner, I wish you all the best in 2020, and hopefully you are going to get great results. I'm confident that when you really understand all these different underlying drivers and underlying causes, you can really be of service to so many patients. And if you're a patient, I hope this was useful. And I'm also grateful to you for listening and for trusting me with your time and with the education about SIBO. And to everyone, I really wish that we are moving into a peaceful 2020 and that you all experience wonderful health and success. All the best.
Thank you for listening to the SIBO Doctor podcast. We hope you found the information in this episode useful in the treatment of your SIBO patients. Thanks to our sponsors, SIBOtest.com, a breath testing service with easy online ordering, and Quintron, maker of outstanding breath testing equipment. Tune in again for another episode of the SIBO Doctor podcast. Thanks again for listening.